But digital mental health care as a field is changing incredibly fast. It's a very dynamic field. So, as I continue my training over the next several years, I think we're going to be having lots of conversations about what regulations and oversight are truly necessary. But something that I believe is definitely warranted is evidence transparency. In practice, this could look something like standardized labeling that discloses whether an app has been clinically evaluated and at what level of evidence. And also, I think it's incredibly important that we have clear specifications around AI delivered therapy, given what we've seen in recent news about certain AI chatbots exacerbating users' existing mental health conditions. AI is definitely, it's such a new field that there's so much we don't know about it. So our regulations are definitely going to develop as we learn more about that technology. We were not able to meaningfully assess disparities related to language access, health literacy, socioeconomic status, or racial or ethnic background in this review, but that was largely due to the limited availability of evidence and the fact that only English language apps were included. However, this lack of data is in and of itself clinically significant. It tells us that there is a tremendous need for more rigorous and inclusive studies to ensure that digital mental health interventions do not inadvertently widen existing gaps in perinatal mental health care. So essentially, it tells us that there's a call for more research in this field. To be clinically meaningful, future trials should prioritize randomized control trials that look at outcome measures like validated symptom scales, such as the Edinburgh Perinatal Depression Scale or the G87. We should also be looking at the consistency of user engagement and certain maternal infant outcomes, such as bonding. And also to circle back to the question posed earlier about disparities related to language access, health literacy, socioeconomic status, and racial or ethnic background, future RCTs should absolutely also report subgroup analyses to assess for any difference in effectiveness among different groups. Um, and in terms of the timeline of follow-up, we really want to make sure we're giving enough time to evaluate a meaningful and sustained benefit. This would probably be on the order of several months to a year. We just want to make sure we're looking at the postpartum period in its entirety. This is such a great question. I think, as I mentioned before, digital mental health care is a rapidly evolving field. So I think our recommendations are going to be changing every single year. But as of right now, I would advise my colleagues to approach these tools thoughtfully. First, know what intervention the app is offering. Look for apps that use evidence-based strategies like cognitive behavioral therapy, mindfulness, or validated screening tools like the EPDS or GAD-7. And secondly, it's very important to set expectations. As it currently stands, most perinatal mental health apps can support self management, but they shouldn't delay someone from accessing in person or telehealth care if they're struggling.